Okay, so we have to learn how to do CPR because our dog right now is unconscious and is not breathing or struggling to breathe, and we have to find out what's wrong, if we're gonna need CPR. If so, what are we gonna do? So first thing, we see our dog is down. This is Fluffy. Our dog is down. First thing I'm gonna do is try to wake him up. He's not breathing and he's not moving. He's unconscious. I'm gonna call him by his name. He's not getting up. So first thing I'm gonna do is open his mouth. Try like open it up, pull out his tongue if I can. Check if there's any obstruction like vomit or a foreign body that I could take out that'll get in the way of his breathing. If that's still gone, if that's clear, I'm gonna check if he's breathing. I'll check if his abdomen is actually moving. If it's not, feel around. He's not breathing his mouth either. And right after, I guess I could just start CPR. When it's gonna be a small dog, we're gonna want to put them on lateral or right recumbency, left or right lateral recumbency, and find out where we're gonna put our hand. It's gonna be over the heart. If we grab their shoulder, elbow, and bring it backwards, wherever that elbow hits on their body, that's where the heart should be. So for this dog, it's gonna be right here. We're gonna remove the elbow. We're gonna put our hand right there, and our hand positioning is going to be one hand on the heart, other hand on top, and we're gonna hold them together, and we're gonna push straight down. We want to prevent having our elbows loose. We want to lock them in place and push down with our back instead of pushing down like this, because you're just gonna get tired quicker and you're probably not gonna make as much strength that you'll need. And we need to do this for 2 minutes non-stop, so we gotta make sure our position is okay so we can go as far as we can. That's for a small dog. If we have a large dog, the same thing is going to be as far as the elbow for normal shaped dogs, like which one was it? Okay, the heel-chested or Dobermans or cats, it's gonna be lateral recumbency. If we have a mid to large size dog, we're gonna do the largest point of their body. So let's say this dog was like this, we're gonna not look for the heart, we're gonna look for the tallest part of the body, and we're gonna do our hand positioning there and go from there. If we have a flat-chested dog like a bulldog, and I actually have one, if we have a bulldog like this, we're not gonna put him like this because he's flat-chested. We're gonna actually put him in a VB position, and we're gonna go from the sternum and push down from there. But I'm gonna show you how we would go for doing CPR on a large dog. So I'm gonna look for the heart position, and then I'm gonna put my hand and my other hand on top. We're gonna cross the fingers, and we're gonna start pushing down with our full back. We're gonna do this at a rate of 100 to 120 chest compressions per minute, and we're gonna want to do it again laying on the side, and the amount that we push down should be 1/3 to 1/2 of the chest width. So if the chest is this thick, I should only be going down either this much or this much. And that's what's gonna change of how much pressure you're actually gonna do depending on the size of the dog, is how deep you're actually gonna go. We wanna make sure that the head is straight in normal position so that their airway is open. We don't want our dog to be like this or hyperextended. So we want them in a normal position, and then we're gonna start CPR. So the compressions isn't the only part of the CPR. We also want to do our mouth-to-snout artificial respiration. That's going to be a ratio of 8 to 2, or it's gonna be 8 to 10 breaths per minute, which is gonna be around 1 breath per 10 seconds. If we're doing this by ourselves, it's gonna be a bit complicated because we have to compress, take a break, and actually blow. But if we have someone with us, we're gonna want them to do it on their own over there. The way that we do our nose is that we want to make sure that we use the lips or the upper part of the snout to cover the full part of their lip on the side. So we're gonna grab like that, we're gonna hold down, and then we're gonna go ahead, put our mouth onto their snout and blow twice. So it's gonna be and we're gonna want to hold that for about a second or two, and yeah, we're gonna do that simultaneously while we're doing our compressions, but I'm just gonna show you the rate at which we're gonna actually be doing our compressions. It's gonna be, I'm gonna do 30 and then I'm gonna give a breath. And then I'm gonna come over to the dog and I'm gonna go. Come back, same thing. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. And that's it. Once we finish our CPR or our first session of CPR, we're gonna, if we're tired, we're gonna want to switch out because we're gonna get tired midway of our second cycle of CPR. So if we have someone with you, we're gonna take at least, at most, 5 to 10 seconds to check our vitals and check if we're actually having any breathing. Check for any breathing or movement from the dog and see if they're actually waking up. If not, we're gonna have to go on to our second cycle of CPR. We're gonna have our assistant or helper do that for us, and switch roles. Things that we're gonna want to check for is, of course, breathing. We're gonna want to check, if we can, our femoral pulse real quick for circulation, and continue with our CPR for one, two, or three cycles. And then as soon as we get breathing or a pulse, we're gonna want to rush to a veterinary hospital if it does happen at home. If not, we'll take care of that at the hospital.